Good evening, sir. Am I audible to
Uh,
you?
yes, good evening.
Yes. So, good evening, everyone, and I'll introduce today's speaker with us, Dr. Narendra Chand. He is currently working in Royal Palace, Morocco, and before he was working at Moraji Desai National Institute of Yoga, and he's the passed out student from the 13th batch of BNYS from SDM College, and he's taking today's topic, personal physician, which is very new for me also, sir, and for everyone. So thank you so much, sir, to come on this platform and have your time, sir. Thank you, sir.
Thank you. Namaste. Good evening. When Bhavit asked me that he wanted me to talk in this webinar, I was wondering, what should I say? We have amazingly talented BNYS doctors with us. They have wide range of expertise. Some are pioneer in research. Some are great clinicians. Some are excellent in academics. Some are doing great in wellness industry. They are managers, spa managers, even the regional directors we have. They have wonderful things to say. Comparatively, I have nothing. So what should I say? It was even difficult to find the right topic of my talk yesterday when I was talking with Bhavit. But then everyone has their own journey, stories of success and failures, ups and downs, and sometimes they are worth sharing. So here I am. I am Dr. Narendra Chand. I'm from 13th batch BNYS from SDM College of Naturopathy and Yogic Sciences, Ujre. Originally, I'm from Nepal, and currently I'm working for a prominent member of Moroccan royal family since 12 years. And for next few minutes, I will be sharing my experience with this profession so far. I request all of you to listen it like a normal, non-formal conversation. Though I will be speaking most of the time, but we take it like a conversation, take it like a tea time talk with an elder brother, okay? So our community is doing commendable job by giving subject-oriented talks. I just listened to Dr. Gulab in the series of webinars. It's everywhere in the internet. They are doing the commendable job. So I do not want to give you another lecture, which is about some disease or some naturopathy topic. So it will be absolutely my perspective. So I told you I'm from 13th batch. So I'm at the point of time which you can consider the midpoint of evolution of BNYS degree, because I'm from 13th batch, and when I look back, it's 13th batch behind me, and when I look forward, I think the batch which is coming out is 26th one. So we are at the midpoint. So I can give my perspective, even from this far, about what we are and what we can do. During the course of my talk, I will be giving 5 lessons that I have learned from my journey so far, so which may be helpful in yours too. I believe so. So I was born in a remote village in the hills of Nepal and moved to India where my father was in military. We moved back to Nepal just before my high school. So my background was non-medical. In my whole family, in the whole generation, there is nobody with the medical background, not even a lab technician or a pharmacist. So I have no idea what I wanted to do with my life. So after my school, after my college, like my plus two, with this military background, I went to Kathmandu, and there I have been trying for a few things. Few things worked, things didn't work. So then talking with few friends, then I have this first exposure of naturopathy and yoga. Before that, you will not believe that I have not even heard about this word naturopathy. I know that I knew that there were doctors of Ayurveda or even homeopathy, but I thought I was small. I thought that they are almost the same. But then when I was exposed to naturopathy and yoga, then there was a little interest of studying this. And then I found this opportunity to go to India and study this. And the seat was provided by the Indian embassy in Nepal. So I thought it's a great opportunity. So I went there. And this is the first time I went to STM college. I loved the building. I loved the atmosphere. And after a few days in first year, it was the first day when I was wearing, because the first day when you go like your casual wear. And then after a few days, they take the measurement, they give you the apron. So the first time when I was wearing this white apron, I had tears in my eyes. So nobody noticed except one of my classmates, and he was asking why. But I didn't know why, but I think it was a beginning of a journey. So, and I was thinking if my parents were there, so they would be proud to see me in this white apron. So from there, I knew that I have taken one direction, and I worked sincerely. I studied sincerely. I, I, I did all my assignments. I did everything. My teachers, they love me. I hope so. So, and the learning was a little bit difficult in those time. I'm telling, it's 2001 batch. So the internet was limited. I I remember that just for 1 hour of internet, we had to pay around 20 or 30 rupees in STM college, not our college, the another one, STM college. We used to go there. We used to make a queue to take this one. And why we were going there to just to listen to, just to receive the emails, and if there is something to search about like Google. So we used to go there like once or twice in a week. So you can imagine it was difficult. It was difficult for research. Once it was Dr. Naveen, and he said that there is a lot of research, and he gave us the list, and it was like a written one. So then we have to, sometime we have to look for the journals, we have to look in the internet, and it was, what I want to say, it was not this easy those times. But anyway, I studied, I passed with gold medal, and my first job was in a small hospital in Indian state of Uttarakhand. It was close to my home, so I took this job. And my salary was low. It was 7,000 rupees. I'm revealing it. And but when I was there, I was not really satisfied, because I was thinking it will be something different. But when you see that the things are not working according to your plan, so you keep changing. And so I moved to spa industry. So my first lesson is this one. Big journey starts with small steps. And I was willing to take the risk. I was new. I was new in the field. I had nothing to lose. Even if I change the job, if I leave in 1 month, 2 months, I have nothing to lose, because this is the time I was allowed to make mistakes. So I made my own decision, and I don't regret about it. I took challenges. I I did this spa job in Nainital for a few months before moving to Agra in India. And in Agra in India, it was a big hospital, a big hotel. It's a five-star hotel. So I had more exposure. I loved it. But again, I changed in few months, and I moved to another hotel. And from there, then I got this job. It was in 2008 that I got this job. So I have been always supported by my seniors, my classmates, my colleagues, everyone. And this job was not meant to be a doctor. Originally, this job was, they just wanted some therapist. But when I see that what I can do with this job, what I can prove myself with this job. So as I told, I was willing to take risk. And I didn't know even in which part of the world this Morocco is, and for what person I'm going to work. I didn't know that. I had no idea. I just left my country blindly, and I did this. So I came here, and that's how I started this job. I made my own decision, and I don't regret about it. I took challenges. I listened to my seniors. I listened to my family. But at the end, it was my decision what I was doing. So After this, I continued, but in between, when I was thinking that I'm not fulfilling what I desire to be, I wanted to do, I left the job and I went back to India. For one year and a half, around 18 months, I've been working with Morarji Desai National Institute of Yoga. But meantime, I was coming back here. I was coming back here. I was doing my old job for 1 month in a year, and then in 2011, I came back here again. And since then, I'm here all the time. So my next lesson was that there is always someone who is better than you, but you try to be the best version of yourself. And this attitude of mine helped me to stay in this job. There were, I told you, there were many ups and downs. There were many times I was lost. But I knew what I wanted. So when you are stuck in this kind of things, and when you see that somebody is trying to push you, because in like any other profession, there is always somebody behind you. They just want to push you and jump in your place. So what do? You have to prove your capability. You have to prove yourself every now and then. And then you have to prove that you are the asset and not the liability to your company or to your boss. There is tough competition, so give your best. You have to be adaptive. You have to be flexible many times to prove your worth. And that is how you are going to survive for long in any kind of profession. It's true it's any kind. There is a tough competition. But I have this very unusual career path. So that's why when in the beginning I was telling it was difficult to even define, because when you say, when somebody asks you, what do you do? For some people, it's very easy to say what they do. They say that I'm a professor, I work in this naturopathy college. I'm a doctor, I work there. But sometimes it's very difficult to define what you do, right? But how you survive is by learning. So my next lesson was never stop learning. I have been learning since my college days, since my first anatomy class. I remember many of the things that I learned in physiology, in biochemistry, in modern diagnosis, and these subjects, they stay with you forever. I can honestly tell you there were few subjects I will not mention here, but there were few subjects I was not really, because there is something called belief. So there were few subjects I didn't have belief on. So I didn't practice that. Okay. But in few subjects I have belief, and I knew that this can be a tool, this can be an asset that I can carry throughout. So I have been learning it again and again, like anatomy, physiology, biochemistry. I have been doing lots of revision. I have been learning. I had a lot of free times with this. Free times other than traveling, I should say. I've been traveling a lot. But other than traveling, whenever I have the free time, I have been doing the courses in EDX, in Coursera. Recently, I did one cognitive and behavior technique for back pain from Oxford. I did the courses in mindfulness. I did the course in pain management from NHS UK. So I have been learning, and this helps me a lot. You see, I passed like 13 years back. So a lot of things have changed. And I can tell you honestly that since the day I left STM, BNYS, CNYS, I never been back to that college. I never had the opportunity. I wish I should have gone, and I will to go back again. But what I'm saying is my exposure to academic part of naturopathy or the BNYS is nil. So I have been trying. I have been improving myself by the courses which are available online. So I have been doing that. and I have been implementing these. So you have to implement what you are learning, and you have to learn from what you are doing. Because I know that you are not just a doctor. I'm not just a doctor. What does a doctor do? Doctor sits, doctor do a diagnosis. He does a complete physical examination, and then he write the prescription. We do the same. So we are a doctor, but we are not just a doctor. We are therapists. In some settings, you don't find somebody who can do massage. You cannot find somebody who can do acupuncture on behalf of you or do other therapies. So you have to do that. So you are a therapist. You are a pharmacologist because you tell your patient that you have to add like 2 teaspoons of honey with this many milliliters of water with this drops of this extracts. You know the composition, you know the ratio. So you are a pharmacologist. You are a psychotherapist because unlike the modern doctors or the conventional doctors, you sit for hours and hours with your patient. You listen to them. You listen to their problems. You counsel them. You're a psychologist. You're a psychotherapist. You are a social worker because you do not just change the patient. You try to change their whole environment that they live, their day-to-day life. You try to modify them. You are a lifestyle modifier. So you are a social worker. You're a spiritual healer. Because why I'm saying is my perspective from the West, when they see that you do yoga, so for them it's something spiritual also. And when you see them and when you speak with them with this spiritual touch, so you are a spiritual healer. And believe me, it works. And your knowledge, your experience, and your learning, it defines your character. And about character was my fourth lesson, which is build your character around your profession. You are called yogi, and it will be highly unacceptable if you behave in contrary. They call you yogi or the doctors, but if we are behaving just the opposite, we are not practicing what we are preaching, then there will be a lot of opposition. So you have to practice what you are preaching. So you have to build your character on your profession, because this profession, it's like a tag in your, in your forehead. You are a yoga and naturopathy doctors. So you are supposed to behave in some particular way. I'm not saying that you have to limit yourself, because everyone has their own life. Everyone has their own private life. So whatever you do in your private life, it should be something different. But what I'm saying is your interaction with your appearance in front of your patient or in your client should be something like that. Because the West view you as somebody who brought yoga. Okay, so they expect something very, very, very different from you. But then when I say about the character, so you have to respect the cultures, the tradition, the religion, the food of everyone non-judgmentally. You should not judge. We proudly say we are from Indian subcontinent, right? So you must have heard most of the time that our food is the best food in the world, but maybe you have not heard about the Mediterranean diet. The people living in Mediterranean region, they are the longest living people on the planet. Why? Because their food is something. Our food is good. Maybe there is a little bit of deviation from what our ancestors have told. That's why we are the hub of diabetes, and hypertension, and all the coronary heart diseases. So there is something wrong, right? So this is not the time to be proud of our food, rather than to change if there is any problem with that. So yes, you should not judge the people, You should not say that I am better than you, because when you say, just because we are from Indian subcontinent, so we know yoga better than anyone else? No. There are many people, they were doing yoga and they were studying yoga since they were small. So we don't own, we don't have the ownership of this science. This is science. This is open science. Everyone is doing this. It's the same thing like if a Chinese is thinking that acupuncture belongs to them, will you believe them? No. They will give you a very strange look. So don't give the same strange look to a Westerner when he is doing yoga. Okay. So it's everyone is doing great. When I travel, so I have taken classes in New York, in Los Angeles. I have taken classes. I didn't tell them what I do. So I just go to their classes. I took the classes very silently. I try to learn. I try to learn what if there is anything different that they are doing than what we were practicing. I take them. I try to analyze it, that what is different. And if there is anything that I can take from them, I take them. You should be very open to share and learn. And we have to make a very trustworthy relationship with our client. They believe you, they trust you with their life. So we have to feel that responsibility. We have to be very honest and we have to be very consistent on what we are doing. And then we have to prove ourselves valuable for the company and for the boss. And then I will come to my last lesson. Lesson is to set your priorities right. You have to set your priorities. My priorities 10 years back will be different than now. And maybe in 10-year time, my priorities will be different. So you have to see what your priority at that particular time. Whenever you plan for something, and I think this is because the people who are already in BNYS, so they already know what is their priority, right? They have to study, they have to pass the exams, they have to pass the viva, they have to face internals and externals, which is difficult, right? But your priorities, when you come out, or even when you are intern, so we have to think what is your priority, and it can be different, and it can be changed. So there should be always not a goal, okay? There should not be a plan, but there should be a direction. Because when you make plan and if it doesn't work, you may become depressed. But rather than telling it a plan or a goal, tell it a direction, because then you are more clear that, okay, I have to go on this side, okay? It happened to me many times that I was stuck. Like the first time when I was leaving any other job, I left like few jobs. But to be frank, I have left less jobs than some of my friends. So I'm in a safe position, right? So whenever I'm stuck, so what do? I make a flow chart. So for example, I want to leave this job. So I have to visualize that what are my options? My option was to go back to study, or to finish my master's, and to change my job and take another job, which I have to fix before I think I will leave this job. Okay. So when I go for this one, that I want to leave the job and I want to study, so I have to think 5 years by now. 5 years, I will finish this job, this study, this course, and where I will be. What will be my worth after 5 years if I leave this job and I go for study? Is it worth it? If I go to this job from 5 years now, where I will be, I have to visualize that. And then even if I study, I will say two types. Okay, because for me, I wanted to study public health and I wanted to study rehabilitation. I wanted to study neurosciences. So I think all the three paths, if I do this, what will happen? If I do this, what will happen? If I do this, what will happen? So I had a complete chart in front of me. This helped me to decide how I have to behave. And many times I was just crossing them. Okay, this doesn't work, this doesn't work, this doesn't work. I will go like this. Okay. And this is how I went. So I took my risks by evaluating that what I'm going to lose and what I'm going to gain. I was taking advice from my seniors. I was taking advice from my family, but they were just advising me. It was no any other influence. But I'm very fortunate to have a very supportive family, because whenever I decide something, even if I'm married now, even when I was not married, or even after my marriage. So they were very supportive me with each of my decision. And you are the product of your own decision. So I decided many things. When I was thinking back in 2009, 9 years, that I was not doing enough here. So I left the job and I went back to Morarji Desai Institute, National Institute of Yoga. It was a very tough job, because coming from Europe, I was going back to New Delhi, in the streets of New Delhi. I was the yoga physician for 10 of the dispensaries of CGHS dispensaries. And my senior, my officer, gave me a job to open 10 more. So you can imagine, to open 10 more, I had to visit 30 more. And I was going there all the time. I was visiting like 30 of the dispensaries, talking with the CMOs, convincing them. And in every time it was like giving an orientation to them that what we can do there. And even during this job, I was traveling like from one dispensary to another dispensary and back to Morarji Desai like once in a day. I was doing that. So it was a difficult, but I was happy. And then I decided to come back. Then again, it was the same. I visualized my plan, like where I will be. If I'm doing the same job for 10 years, where I will be. So I came back here again. And why I came back here, it was my fourth point, that you have to build your character around your profession. So maybe my character was something like that, that my boss, they keep calling me. They requested me to come back, so I came back. And in 2012, I had this opportunity to work for International Conference of Naturopathic Medicine. So it was the first international conference where we were successful to bring around the first time around 200 am I audible? Because I'm just keep talking. Am I audible?
Yes, sir.
Okay, perfect. So no, because when you keep talking, so we don't know.
It's clear and
Sorry, excuse me, Bhavit, can you please reply? Hello, hello.
yes, sorry, sir. Network issue. You are clear, sir.
Okay, perfect. So what I was telling about, it was about ICNM. It was in 2012. So I joined ICNM, and in ICNM, it was the International Conference of Naturopathic Medicine. We were successful to bring the naturopathy doctors, around 200 from different part of 24 countries. They participated in this international conference. And we did 2 in Paris and 1 in Barcelona. And after that, I left the board. I was in the organizing committee, the board. And during one of such board, I met one of such conference. I met Dr. Gulab also, although I know him before, but he came to one of them too. And in one of them, there was the formation of World Naturopathic Federation. I hope you have heard about it. It was the only one federation which connects all the naturopathy professionals in the world. So this was the product of one of the ICNM conferences. So I did few things there. I have been fortunate to meet some wonderful doctors around the world. But then I realized that it's the naturopathy, what we practice and what they practice. It's fundamentally it's a little bit different. So, but then I left because I have been traveling a lot because of my current job, and I could not keep with the changing environment and the schedules and the interviews and everything. It was a little bit difficult. Even with my further studies, I could not do many things because sometimes for the educational institutes, you have to attend the interviews, and I could not attend that. So this was my story until now. I'm here since 12 years, and it had been a great journey so far. And but this is just a journey. It's not the destination. So I'm willing to do more. So and let's see where it goes. So at the end, I just want to clear that this was absolutely my perspective, right? It's I'm not at the dusk of my career, but at least as an elder brother, if I can advise you something, if I said something that is helpful in your career, in your student life, if my words make some sense in your life, I would feel that I have not wasted your time. And so if there are any questions, so well, this was because this was my story, so I don't think that you can question my story, right? So but still, if you have anything, if you have anything to say, if you have anything to share, so I'm open to the questions. But I request you to be in contact with your seniors. Be open to networking with the seniors, the classmates. Even when you go out, be close to your classmates. That's how the thing works. I don't know how it works now, but because when we left, it was a very small community, and most of the time we know each and everyone of our seniors and juniors. And but now I think it's the community is growing and growing more and more, and it's a good thing. In a way, it's a good thing. I'm so happy that how our the seniors were wonderful, no doubt, but how our juniors are doing in the field. I'm really proud of them. I'm proud of Gulab. He is doing a wonderful job. His when he speaks in YouTube, I see his channels. He has like 200, 400,000 viewers. Wow, this is great. He's doing a wonderful job. So if you have any question, so I will be open to the question. Bhavit, I see there is a lot of chat. So,
Two questions were there, sir.
you can do one thing. I will not read the question. Can you read that to me?
Yes, sir.
Okay.
So there is a one question like how to choose the course in Coursera and why we choose like that particular course according to need of that or for you, sir. You have done a course in Coursera.
Well, okay, I will
Like
just.
about the course, Coursera.
Yes.
So that was the question, sir. What was the like options to be taken in the choosing the course, online courses in course? Which option, like which courses are good? How to choose? Kind of.
Okay. So, in Coursera, it's an open platform where I think in Coursera there is Cambridge who is giving, there is John Hopkins who is giving the courses. So what I was doing the courses that is relevant to my profession. For example, there were courses in exercise physiology, okay, which is very relevant to us, and I suggest that you do that. Then there are courses about diabetes. I done like 2 courses in diabetes, so which is absolutely it belongs to us. There are courses in obesity. There are courses in public health, depression. So there are like small courses, and they are not really. They will not consume a lot of time of yours, but they are very subject oriented and they have very good material there. So But then I don't know if you're aware of that, because these courses are normally free. But if you want a certified courses, then you have to pay a little bit of money, and then they give you the certificate. In EDX, it's the same. For Oxford, it was about CBT, cognitive behavioral therapy, and it was about back pain, and it was the area of my interest, so that's why I did that. And even in NHS, it was about the pain management, and it was really something. My concept of pain is a little bit changed. I don't know, because it's been long that I left the school, so I don't know how, if the courses have been changed or something. But my perception about pain is a little bit changed after doing this course. It was a little bit difficult, but I loved it, and it's good. And I suggest that you should be doing that, or else if you want to ask something about these things, I will be open to answer that later. Yes. Any other question?
So next question from Shravanti. Sir, is doing masters in correspondence work. Can we gain knowledge and learn things even without going to college?
Of course. I think many of our seniors, they have done many things in correspondence, and you have to think that, because I don't know how the correspondence courses in India they work, but when you go for the online courses in Europe or US, because sometimes they have the online courses, like there is an online class from the lecturer, and then he will be asking you the question if you have a doubt. It's like a real classroom, and and the the validity of the online learning is more now, because you have seen that many of the courses they move to online platform because of COVID. So more and more people are now doing this, and I think in future, this is the future. I think more and more people, because of their busy schedule, because of many things, they will be doing online courses. I think it's valid in few courses, in few things. For example, if you are studying psychology, if you are studying public health, if you are studying few things that you are not needed to go to the college. I'm not telling about the BNYS, because some quacks are giving the same course like BNYS, or I don't know what they call them. They give it by correspondence. Don't do that. It's not. And you have to oppose it all the time. They are not real. But the courses like psychology, where you can learn, but see that it should be coming from a valid university or a valid institution. Try to practice it. It's not just you are doing it. You have to practice it. If you're learning psychology, so try to to include that in your practice, and that's how you can excel. Anything else?
So we will wait for 1 or 2 minutes. If any questions are there, they can unmute and talk to you.
Yeah, but yeah. So
One person, yeah, one
so
by one. If that,
sorry.
one by one, they can unmute and they can talk to you.
Yeah, of course they can do that. And because nobody asked me, but I was because when I'm in Europe, so maybe you are wondering. You are still, few people are still student, but other people who are watching later in YouTube, or the people who are coming out in few years, so they may be wondering what is the situation of naturopathy and yoga in Europe. So I just wanted to clear about that. I prepared just for that. Okay. So when you see about naturopathy and yoga in Europe, so it's not considered together, right? It's both are different. So it's not, it will not be normal if the same person is doing yoga, naturopathy, and the same person will be doing yoga. So it's considered a separate entity here. So the naturopathy and yoga is not necessarily considered together. In general, both of them are well accepted. Okay. So you can practice as a healer, or you can practice as a health educator and freelancing without any problem. And they consider it as a care outside the regulated framework. Okay. So having said that, each countries, they have their own law about that. So this is a care outside the regulated framework. So as I told you, so you are not entitled to say doctor that you are a doctor. You are not entitled legally. You are not entitled to write doctor in front of you. You cannot diagnose, and you cannot interrupt any ongoing medical treatment. This is what I'm saying is it's in the general practice. I'm not general practitioner there. Remember, I have a private practice, so it may not be considered for me. So, okay. So in France, what we say, there is no regulation, there is no certification. Though there is chiropractic and osteopathy, which is recognized since 2002, acupuncture is practiced by a MD doctor, like a conventional medicine doctor. After doing some training, they undergo training because acupuncture is a big thing. Many times they practice it, they believe in that. So they practice this, and mostly these people are the MD doctors. They underwent some months of training in acupuncture, and then they are practicing it. And freelancing is possible in both yoga and naturopathy and anything, aromatherapy, reflexology, massages, and hydrotherapy, everything. Freelancing is possible. In Switzerland, it's regulated, and it's even covered by insurance, and it's in their national health scheme. In Hungary, it comes under alternate medicine, and it can be practiced freely. Okay, you can practice. If you are in Hungary, you can practice it. In Ireland and UK, you can practice without a title of doctor. And mostly when you practice it, you are practicing freelancing, or you are practicing in a big hospital with a multidisciplinary team. Okay, and you are recruited by a big hospital, and then you are covered by NHS. So in Ireland and UK, this is the situation. In Germany, it's important. In Germany, this may be the first country who has the license. So in Germany, naturopaths are licensed as Heilpraktiker. They are called Heilpraktiker. They have a national-wise licensing exams, and when you pass that, and you can work independently. And it is a widely accepted profession, Heilpraktiker or naturopath. They call it Heilpraktiker. In Norway, Sweden, and Denmark, there is a freedom in practice as a healer or health educator, as I told before. If you are there, you are free to practice. In Spain and Portugal, in many states, it's regulated, but they come under the Ministry of Labor rather than the Ministry of Health. But I think in Spain, yes, in Spain, in some states, they are in talk with the government to include naturopathy under the Ministry of Health, not the Ministry of Labor. And in these countries, they have the total autonomy in the practice. So you don't need the referral. Okay, you don't need the referral. You can write the prescription, you can independently open your cabinet, and you can practice in Spain and Portugal. In Italy, it is approved in some northern regions. In Belgium, it is recognized as a profession. I have been to US and Canada, so I can tell you that in US and Canada, it's regulated, and in some states it's regulated, but they are NDs, they are not BNYS, and I do not know if they have the equivalent. They don't give the equivalent, as far as my knowledge is concerned. If you are a BNYS, you go there, and maybe they will take some credit from your old studies or old syllabus, and then you can enter ND, and then you have, but still you have to finish your ND to be a naturopathy doctor there, and you can practice. And they are widely accepted. They are covered by insurance, and homeopathy comes under naturopathy there. And you are mostly working as independent or as an integrated practitioner with other professionals, and you can even prescribe drugs there, including opioids with some restrictions. I think you can do that. And for yoga, I think yoga is not really regulated in many places. Even in US, if you can prove that you have these many hours of yoga education in India with this course, I don't think that you need to take you need to finish the minimum standard of RYT with what is the name, International Yoga Alliance. You don't have to do that. So if you can prove that you have already studied that, you can practice yoga. There are some schools which are widely accepted there. For example, if you say you are from Shivananda, they know that. If you say you are Bihar School of Yoga, they know that. So this is the situation in all over the world, in the world that I know. So this is what I wanted to add. So shall we take questions, Bhavit? There is something.
Yes, sir. There are three questions. Maybe it is covered anyhow, but I'll tell you, sir, what are the questions. From name is not mentioned. What type of license we require and how to get it in Europe?
Sorry. Can you? I will check.
Yes.
Wait.
What type of license we require and how to get it?
It's a question about. Okay, what type of license we require? Okay, the same thing I already told you. The problem is like in many of the European countries, the license is given to their citizens. It's not that, okay, I have a degree of BNYS and I just want to move in this country and practice. No, we cannot do that. Okay, because if you see the policy, the law of migration in many countries, in US, in Canada, because in Canada they have the point system, in Australia they have the point system. Point system is like, according to your profession, they give you the points, and if you have a particular point, you can legally migrate to that country. But no, but in those the list of profession, I don't see the naturopathy is mentioned. But if you are in this country already, if you are a citizen of this country, it can be like, it can be, well, it will not be a little bit, I mean, right to say, but if you are married to somebody who is citizen of this country, and if you are legally living there, so the list of countries I told you, you can practice definitely there. So, for example, I was telling about Germany. So if you are a German, you just write this exam, this license, because they have one course. So you have to write this exam. You have to pass this licensing exam, and you can practice. Okay, and in US it's the same. You have to pass the ND before. I don't think that for BNYS there is they will give you the license right away. But if you are in Europe, if you are already there in Australia, in New Zealand, in US, in Canada, if you are already there, so you can definitely practice the things that I told you. And to go there, I think there are many ways. If you are the children of the citizen there, if you are sibling of a citizen there, if you go there as a student, okay, if you find a job and the employer is sponsoring you, so these are the ways you can go there. And once you are there, then you can find the way. You can do freelancing, or you can write the licensing exams, and then you can practice it. Yes. So can you please tell about London and Canada? I think I told. Can we practice in Switzerland? Switzerland, it's the same. I think that the license is open only for the citizens. Switzerland is one of the country which has the toughest immigration laws. So it is so in Switzerland it will be a little bit difficult to go there, but if you are there, yes, you can practice. There is somebody who is asking me about South America, like Ecuador. I really don't have any idea about Ecuador. Sorry, I've never been there. But maybe in internet you can do. No. I know about Costa Rica. I think Costa Rica, I saw few people they are practicing, but there is no regulation, but they are still practicing there. Yes, anything else? So I don't see Bhavit.
Yes, sir. There is no questions.
Okay, that's good. It's a good sign that there is no question, because, well, I told you it should be like a conversation. Okay, I would be happy if somebody is coming and they're telling their own experience, or if they, let's say if there is somebody who is in internship or in the college and they just want to tell their experience, so I would be happy to listen, right? So is there anything? You can just raise your hand and Bhavit will unmute you. Is
Yes,
that okay?
for sure. If they are ready, anyone
Because
you can.
no, because I told you, Bhavit, it's like it's long time that I never been. I I haven't been back to my college, so it was really inspiring to see all the students and the interns here. So it will be nice to listen to them.
See,
And
selecting
some,
them.
yeah, and sometimes, like, you know, you have to change the way you see, because I was listening to Dr. Gulab's talk earlier, and he said it very well, because everything comes with the experience. For example, if I never knew before that I have to see the shoes of the patient, right? So when I was in New Delhi, so the person comes with that he has the pain in his back, in his knee, in his shoulder. So I was thinking, why in one side he has the pain? So then I realized that maybe there is a problem in his biomechanics. So I asked him to show his shoes. Okay. So when he showed the shoes, then I see that one side of the shoes has a lot of friction. So he was putting his biomechanics was not the weight, the distribution of weight was not correct. So he was walking on one side. Though when you see them walking, you don't realize that there is a problem. But when you see the shoes, so you see that. Okay, so you have to find these very minute details, and this will come with the experience. And I'm really happy that the person, I mean, the students, they are learning hard. They have a lot of exposure. Our seniors are giving a very informative webinars. I am whenever I have time, I am listening to them, and I'm really happy that a lot of students are following them. And I'm very sure about the future of our future generation. And you know what? This is the best time to be a naturopath, because until now, what we were doing, we were focusing more on non-communicable diseases, right? Hypertension, diabetes, obesity, this and that. But then we went back to the basics of naturopathy. What was the base of naturopathy was the seed is nothing, the soil is everything, right? And this is the thing which is proved now with the COVID-19. You see how many people, they have this infection, but they are asymptomatic because they have that robust immunity to fight that, and they survive. I have one cousin in New York, and he was telling me he works in the intensive care, and the room is full with the COVID patients. And when you see them, so he was telling that the most of the patient who died, they are not the patient like with this. It doesn't correspond to the severity of their disease. It's only the people who has a very good willpower, a positive outlook on their situation, on their life. They were successful to come out alive. And the one very healthy looking, but in ventilation, but they are hopeless. They do not want, they are frustrated, they have very negative outlook, very pessimistic. So they are the one who succumbled to this infection. So you see, we as a naturopath yoga doctor, our role is to build up the positive outlook of the patients. And this is what are helping the patient to fight even a deadly disease. It's not a deadly disease, it's just another infection. So it's helping them to fight. So our responsibility is more after post-COVID, or even during this, because you have seen like many seniors, they are working in naturopathy hospitals, they are working with COVID patients in India as well as in Nepal with wonderful results. So I'm very encouraged to see what we are doing right now. And I think this is the best time to be a naturopathy and yoga doctor. So if there is nothing, I think we can just stop here. Is there
Yes, sir.
anything?
There is a question, sir. It came privately, sir. Like it came to me, so I'll just let you know. If our degree is not valid in any countries outside, so what we called as a therapist or something else.
Sorry.
If our degree is not valid outside, so what we called as a doctor or therapist.
It depends upon you. If you well, what I'm saying is not to be called as doctor. It's only the legal thing. If you sign a paper, then you don't write a doctor. But for your patient, you're a doctor, right? Because you have done this, so you're a doctor. They will call you a doctor. It's only when it comes to the legal part. Okay, so you are not considered in few countries. And when you do the freelancing, so I don't think that, because in Paris, I live in Paris, so in Paris there are many cabinets. They don't call it clinics, so they call it cabinets. Okay, so it is a cabinet. Even for dentists, they call it the cabinet of a dentist. Okay, so it's a cabinet of a naturopath. Okay, so your profession is protected by the Ministry of Labor because you pay the tax, right? So it's your profession, and in this cabinet, whatever you are doing, it's between you and your patient. Okay, so if the patient is comfortable, so it's up to you, because you know our basics are very strong. We have studied almost everything what a doctor should learn. So you have to be confident on what you are doing. So, and then you don't need to be you don't you are not obliged to have the title, right? So it's between you and your patient. If they call you doctor, it's fine. If they don't call you doctor, if they call you yogi, sometimes they call me yogi, so I'm fine with that, right?
So that was the last question, sir, from the people who have attended this session. And thank you for your time, sir, which was very great as a student, as an intern, to learn many things from you. And I hope everyone learned from this session from starting to end. And that is the most important part, the experience, what we should understand as a
Yes.
student or as an intern. That is the most important thing which was given from you, sir. So thank you so much,
Thank
sir,
you.
for the time.
Thank you. Thanks a lot, everyone. Thanks for listening to me patiently,
So thank you,
and
sir,
hope
and
to see you
yeah,
around.
thank you.
Thank
Thank
you.
you, everyone. We'll end this session. Thank you. Namaste, sir. Namaste. Thank you.
Thank you.